Dr. Hoffman, welcome to the show. We were speaking about injuries before, and we thought it might be good to get a doctor on the line who deals with workplace injuries, and I know that you have a history of dealing with workplace injuries at U.S. Health, and we thought that you might walk through some of the best practices for dealing with accidents at the point of impact and also about what businesses can do to sort of mitigate the effects of the injury afterwards. And I know you're from the Regional Medical Director for U.S. HealthWorks, but tell us a little bit first, what is U.S. HealthWorks?
Well, U.S. HealthWorks is a national corporation, and we have around 171 clinics at this point in time in a variety of states, and we have 18 here in Washington State, 15 up and down the Puget Sound from Everett down to Lacey, and 3 in Spokane. And our backbone is occupational medicine. We are open for urgent care as well, and we believe in the right care right away. And I believe that's what helps us practice best practices medicine.
And so when you talk about the right health care right away, I mean, as a restaurant manager, at least once a month, although I'm proud to say at the last restaurant I was at, it started out once a month, and then we started to sort of get into this safety culture that Katie and I were talking about earlier. But my relationship that I had with, believe it or not, U.S. HealthWorks, because you have a clinic right next to the restaurant or very close to the restaurant we were at, I felt like that relationship was really important. Would you say it's important for a restaurateur to sort of develop a relationship with a specific clinic or a specific doctor?
I think that's the case. I think it is important. We all work better together when we know each other and we know what the expectations are. And work injuries are scary things. Sometimes the supervisors, managers are stressed out and the workers are scared. And if you have a good relationship with your local occupational health care provider, that can take some of the fear out of that equation.
What are some of the things that you would say that having that relationship in place, because at times I've taken employees to a doctor. I didn't know the doctor. I didn't even know the place. And then we developed this relationship with U.S. Health. What are some of the things, if you could tell an owner one thing about, having something in place for these occupational injuries, what would that be?
We communicate with our employers and with the injured worker. And I think communication is the key to avoiding so many of the problems that we run into in a complicated system like work comp in the state of Washington.
So when you say it's complicated, tell our listeners about that a little bit. What are some of the complications that having a relationship with and that communicative sort of relationship that solves?
Well, one of the complications is that people don't understand how the system works. And I've spoken to a bunch of employers, and I like to explain to them, this is what we see on this new injury. This is what we're recommending in terms of modified duty, and here is how we'll proceed. And I always emphasize that we will see the patient back quickly, and we try to keep the patients accountable, those injured workers accountable for their health care. We even instill in them at the beginning, you own this responsibility. It's your health. So I think the open communication with the patient and with the employer really helps, because there are so many things that can happen. And what we want to do at U.S. HealthWorks is we want to promote all of the occupational best practices. We want to apply them. We want our workers to be seen on the day of injury. If they're off, out doing something else, they could compound that injury. We want to see them right away. We want to make sure that they have a very good first visit with all of the proper testing done at the beginning. And this draws a line in the sand. This is related to this claim.
Right, because that's what happens a lot of times is that, I've actually dealt with that before, where a week later I'm like, well, you had this injury, and how is this new symptom that you're talking about related to that? And when I had a good relationship with the doctor that my employees saw, that communication, because it's very hard for an 18-year-old busser who just, he's not sure whether his back pain is from the basketball game or whether it's from bending over the bus stop or whatever. And as an employer, I wasn't necessarily putting all my money on his opinion anyway. But when I had a relationship with our doctor in the city in Olympia that I was working in, there was a certain trust component that was there because I knew that they were trying to help me work through the process. And you mentioned process earlier. I mean, for those of you who don't deal with occupational safety and workplace accidents, in Washington State, when an accident happens, there is definitely a process. And I would hazard to say that most sort of frontline managers aren't really aware of that process. What would you say based on your experience? Do people come in with the kid with the cut finger and go, I don't know what to do beyond this? Is that fairly frequent?
Well, that happens some. I think it depends on the size of the company and the years of experience of the safety person. And we do allow our safety people to be in the visit at the first part of the visit. And they are allowed to hear what we're saying, hear what the injured worker's saying. And we like that because that helps keep everybody honest and get everybody on the same page.
So you feel that it keeps the situation accountable and moving forward in the right relationship. Does coming to one of your clinics benefit more than just the business? How does it benefit the worker, the injured worker as well?
I am so glad you asked that question because in occupational medicine, we have these stakeholders. And, of course, the injured worker is one of our huge stakeholders. And we are medical providers, and we care about our injured workers. And so what we do is we see them frequently. We do the right tests. We make sure that they're back on light duty as quickly as reasonably possible. We have really good outcome data that says if a worker is put back on light duty quickly, they have a much lower chance of a prolonged claim, of developing a permanent partial disability, and other untoward things.
That's important. That's really important. Now, I'm curious now, what steps do you take to create the relationship, to inform not just restaurateurs but workers in places that you have relationships with? How are you reaching the people that you're there to serve?
They go on the most popular radio program in...
I mean, besides coming to talk to us today, how do you form these relationships? How do you promote what you're doing? How do you let the workers know you're there for them, as well as the restaurateurs who are probably a little more apt to be aware of you?
Yes. We like to go out and we like to do site visits. There is nothing that helps our medical providers better to know what light duties may be available and appropriate for an injured worker than to go onto a site and see what's going on. We like to go out and we like to give safety talks. And, that's one of my joys. Love it very much.
Wait, I'm going to stop you for a second because I just had light bulbs go off above my head. As a manager of a restaurant, I could have called U.S. Health Works and said, can you send someone here to come talk to my staff about safety in the restaurant? And you would have someone like yourself who could come do that. That's what I hear you saying?
Absolutely.
I wish I would have known.
Fantastic information, apparently. Do you find a lot of restaurants
are taking you up on that?
Yeah, are they taking advantage of that service?
Would you repeat that, please?
Are restaurateurs, do you find that they're taking advantage of that service you offer to go and attend meetings, give workshops to inform the staff? Is that becoming very popular?
No, it's not as popular as it is with some of the other injuries. Some of the obvious ones, some of the other industries.
Right.
Mm-hmm.
Some of the obvious ones you might think about that have really high rates of severe injuries. I'd like to see the restaurateurs call us and ask us to come out and give those safety talks. We're ready.
You know what? I'm going to Facebook it on the WRA's Facebook today. So go to Facebook/WRA.com. And we're going to put that out there. We're going to let people know because, I mean, literally, I didn't know that was something. And I had a relationship with U.S. HealthWorks. And so we're going to get you a couple gigs because I think that restaurants, in my experience, I've fished in Alaska. I've done a couple different dangerous jobs in my lifetime. And restaurants are, they're not at the bottom of the list when it comes to occupational safety and accidents. Where would you say restaurants fit in that spectrum and continuum? Are we close to the most dangerous? Are we?
Yeah. What kind of percentage of all the cases that you see and
come from
restaurant injuries?
Probably about 25%.
That's a healthy number. I mean, a non-healthy number.
Right.
Yes, you're right, and you're right. There are not typically as many of the extremely serious injuries, such as there would be with the Alaskan fisherman job and
Right.
such. But, you know, there are plenty of injuries, and some of them are significant. Oh, my goodness, those knives in the kitchen.
Yeah.
Look out.
Yeah.
Would you say that's the most common injury that U.S. HealthWorks treats, or as David was indicating earlier, do you see more burns?
Well, I got to tell you, when it comes to work injuries, the number one thing we see is low back strain.
Now, does that include the restaurant industry?
Yes, I believe it does.
Low back. I wouldn't.
I
have
was
thought
wondering.
that.
I suspected, actually.
There's twisting, lifting, bending in the restaurant industry.
And so
And
you
there's a
could
lot
come
of it.
into a restaurant and say, listen, we see that this is one of the main injuries that we see coming through. Here's some things that you can listen to me. I'm a doctor. I'm not a doctor. You're a doctor. But things that you can do to really mitigate this and then help save owners with their premiums because their experience factor goes down because they're reporting less injuries. That's kind of the equation, isn't it?
That is the equation. And we could even bring out a physical therapist or an occupational therapist and go over proper lifting techniques right on site there with the various things that the workers must lift throughout the day.
I think it's fascinating that you're trying to, in a sense, it's kind of ironic. You're trying to train people to not end up in your clinic.
Yeah, tell us about that. I would be like putting out banana peels and like, boiling pots of water. Oh no, come see me again. But tell us about that. Is that an altruistic thing? Is that a Hippocratic thing? Is it why are you trying to take business away from yourself?
It's a decent human thing, just like the dentist did when they told us brush your teeth and floss every day.
Oh, that's a good example.
Same kind of thing. We're professionals, and we have to keep it professional. We open 16,000 new injuries a year in this state. There's a lot of business already out there, and boy, we want to prevent new ones if we can.
Oh, that's great to hear. That's great to hear. So are there programs within your programmatic structure? So one, you've just talked about you come and give speeches. Are there other programs like light work, stay at home, that kind of thing that you promote to help restaurants as well?
We sure do. We don't promote stay at home. We promote the stay at work program in conjunction with labor and industries throughout the state.
That's why I lost so many employees. I was calling it stay at home. I got it completely wrong. Man, I learned something today. Yeah, just go part of that stay at home program, and they never came back.
Revolutionary,
Right.
let me tell you.
I'll let you keep going here. So the stay at work program, tell us a little. We've only got a little bit of time left here, but I really want our listeners to hear about that.
Well, the stay at work program enables an employer to get reimbursed for a certain portion of the expenses that they have to keep an injured worker at work on modified duty. In other words, it's an incentive from the state, and it does not count against the experience rating. And I think that's key right there.
It doesn't count towards the experience rating.
Not the stay at work money.
So listen,
that's
restaurateurs and owner-operators, we have Dr. Hoffman on the line, who's the Regional Medical Director for U.S. HealthWorks. We're so happy you came on today.
Thank you, Dr.
Pay
Hoffman.
attention to that Stay at Work program. And if you have any questions, get in touch with us at the WRA, and we'll put you right in touch with U.S. HealthWorks. Dr. Hoffman, thank you for being on the program.
Thank you both.